Hi, Stuart.
Hi, Andy.
Thanks very much for agreeing to this interview.
No
Can
problems.
we start by my asking you to introduce yourself, please?
So I'm Stuart Keeble, and I'm the Director of Public Health at Suffolk County Council.
Thank you. How long have you been in that job, by the way?
It is exactly 1 year today, so it's my 1 year anniversary, and this year has gone very quickly.
Wow, so half your year has been handling a pandemic, a global pandemic in Suffolk.
It has been a steep learning curve, but an opportunity to get to know people and build the relationships in the system very, very quickly.
Indeed. Thank you. I've got 4 questions for you, and the first one is one I ask most people, and that's partly about yourself. So how are you looking after yourself during the pandemic, but also how are you supporting your teams?
No probs. I mean, I think when we started this, I was very much, when I was talking to my teams, I was kind of saying, look, this is a marathon and not a sprint. And as a leader, I want to be a genuine leader, but I've really struggled, I have to say, with trying to pace myself and trying to recognise that. I think as a new DPH, a very steep learning curve and a lot of stuff happening. So I have got to points where I haven't been doing enough exercise, which as a director of public health isn't the great message, but I'd rather be honest with people about the challenges that I face, because I think we all do. And I did actually have a discussion with my mentor, and that's one of the things I do have. I have a mentor, and I have since I've started this role, somebody that I can share with, bounce ideas off, and actually help for me to frame what's been happening. Because I think sometimes we get stuck in a rut, and you start to think, is this going well? But actually you talk through and actually realise the positives. So that's something that I have done. But I kind of was saying, I can't find time to do exercise at the moment. And quite rightly, they challenged me and said, you can't find 15 minutes a day. And so I've been a lot more deliberative now about that, because actually I felt quite ridiculous that I was sitting there going, I really can't find the time for this. So I try and go out for a walk first thing in the morning, and try and go out for a walk last thing at night. And also my brain's ticking over. We all are at the moment. And I try and do mindfulness as well. I've tried to bring that in as well, just to help, just to calm things down a bit, just to take some time and disconnect. But I think also taking holidays is important. And I took a first proper week off a couple of weeks ago and completely ignored my emails, which at first was really quite difficult. I was sitting on my hands waiting for the bleep to go. But now actually very much try to disconnect, spend time with the kids and the family, get in the garden and just try and switch off a bit, because obviously we just can't keep going at this pace all the time. I think for my teams, I mean, we've been talking about and we've been doing regular communication, and I think different people have experienced the lockdown in different ways. Interestingly, for in my team, I have some quite extrovert people, and they've really struggled, because actually they feed off that feedback from being with other people and other ideas. So we automatically jump to certain people that maybe certain people enjoy it or even not find it that difficult. But I think for me, it was trying to understand the different individuals and what they might be challenged by. So we have regular communication. We have some regular check-ins. Some of my team actually try and recreate the photocopier discussion. So they will just randomly call somebody up and just have a catch up, because actually that's what we really miss. We really miss the opportunity just to kind of nab somebody when you're having a coffee, ask them how it's going. And I think for me, I've got to know my team more over the last 12 months and just trying to watch out for signs and just trying to understand where they are at the moment. And I have on a few occasions after a few meetings and that at the end of the day, just dropped a call just to see where they are, because you can sense that they're not as in a good place. You can see that they're stressed. So we've been very much doing that. So plenty of catch-ups, regular updates from me a couple of times a week at first, then we've kind of down to once a week now. And we've also done a survey as well about what people's experiences are and what are the challenges and issues. So we've set up a staff reference group to support that, and so get them to lead on some of that aspect, because in the end it's about everybody's experiences, and people's experiences will change from week to week. Some people have a good week, a bad week, so we need to be able to respond and be flexible. So really that's kind of the focus we've had over the last kind of 6 months especially.
I see. It's good to know that you're honest about struggling to find the time just to look after yourself, which is a peculiar thing, but that's the reality, isn't it, in this situation? And I also like the fact that you recognise that your team will have different feelings and responses to the situation, and the fact that it changes over time, and giving them the power to help address that is really important. Thank you.
Thank you.
So Stuart, my second question is this: how has COVID changed public health priorities in Suffolk?
So it's interesting that we're moving into, and we've been talking about recovery now for a while. I mean, I think I kind of feel very much that we're still in the middle of it from a response perspective. And I suppose that's especially uniquely around from the public health part of this. But I think there's a risk that we throw the baby out with the bathwater and just see everything through what I call a COVID lens. So we see all the news at the moment is the focus is still on coronavirus and its impact. Quite rightly that it's there. But for me, actually, what's become apparent is that the issues that we already knew about before COVID have just become even further increased and exacerbated. So we have a health and wellbeing strategy at the moment, and that focuses on things like as a core priority across a piece of health inequalities. And what we know and what we've seen is that they've increased even further. COVID has just made those things worse. So if you look at the impact, obviously, within our BAME community, particularly, but also if you look at the rates of infection, they're far higher in the most deprived communities. And that's because of the wider determinants of health, people living in houses of multiple occupancy, people working in jobs where they can't work from home. You can't work from home as a bus driver. You can't work from home as a care worker. And so therefore, actually, all we're seeing is that being further exacerbated. The strategy also looks at clearly the importance of the best start in life for children and young people. So we've seen the fact that children have been off school for that long period of time, or at least some children have been, and obviously coming to the end of the last term, some children were going back. But actually that will have a disproportionate impact on some of those children that are most struggling already and just driving the gap wider. We know that obviously the direct impact of COVID has been substantial. We know that probably about 50,000 people have lost their lives to it. But actually, we also know that in the longer term, the indirect impacts of COVID are going to be considerable. The potential economic recession that we're going to see, the job losses actually are going to have as or even bigger impact in the long term. And so the strategy looks at, again, about working age people. So what can we do to create an inclusive economy to get everybody back into work? So if you look at all those things, actually, they're even more important than what they ever have been. So although COVID is a lens across all that we view the world through, we mustn't lose sight of those things. And those priorities are more important now than ever.
That's very interesting. And I like the fact that you're saying that you're actually saying COVID has put a magnifying glass on those health inequalities, isn't it? It's actually been part of a cause to widen them for a lot of people, but at the same time, it's brought it to your notice and your team's notice and the system's notice as well. And I'm fully aware that there are things happening that to address them, which is really positive. Thank you.
Okay.
My third question, Stuart, is what would you do differently if you had your time again? That's a tough question.
It is, and I suppose I'm seeing this from a very new DPH. This is my first rodeo in that sense around this, and in a positive sense, obviously lots of important learning opportunities that come from these situations. I think one of the things I would do is that obviously I've been really focusing on what's called the health protection response, and that's about how we prevent the spread of COVID and how we kind of manage outbreaks. And I've just been talking about the impact of health inequalities, but actually I think one of the things I would be doing from the beginning is talking about the linkages between those. It's been very easy to focus on, right, we need to suppress the virus and stop it, but actually, given what I've just said about the impact of those wider determinants, I think we need to be talking about them in the same sentence all of the time, because actually that's the key bit. Actually, in some semblances, we can try and suppress the virus, but actually those wider social issues around overcrowding in housing and other factors that can continue to feed into these issues. So if I was going to do this again, I think I would be talking about that far earlier, because I think we need to be looking at actions in both those areas, not just from a health protection response. I think the other issue that I think about quite a bit is that I would do more earlier on in trying to support our more diverse communities, and especially BAME communities, around the messaging and the support. I think we did a lot of messaging and a lot of communication, but I don't think we thought about enough, or if I would do it again, I would be thinking about how do we work with those communities earlier on about how we make the information we're going out salient and culturally appropriate. And actually, Andy, it was one of the things you said in a meeting that I think really I picked up on, and it was probably a few months ago now, but But and I may get this wrong, and you can tell me if I've got this right or wrong. But in the Syrian language, the word household doesn't have the same meaning as what it does in the English language. That actually household means a far more community perspective. And so we're giving out messages saying people need to stay in their household groups, but actually culturally isn't particularly appropriate, and it won't have as much sense. And I think that kind of typifies the learning that's gone on and what we need to be thinking about and what we're trying to do now to make sure that the messaging that we're doing to our different communities, whether that is BAME or it is also other communities that maybe have communication and language issues, that we may need to be doing in a different way. And I would say that I would be very much wanting to, I would have done that far earlier, and I would have been doing that in a way that brought the communities in to try and bring those resources together. And I think the final learning point, and I think it's often when we're under pressure, we kind of recoil into ourselves and in our teams. And by nature, I'm a system worker. I like to work with other people, and I think early on we got within the public health team into such a kind of focus on health protection that we kind of we retrenched into ourselves to kind of manage that. But actually, when you're under pressure, the best thing we can be doing is to go and work with other people and to work together. And that was a conversation that I had with a few colleagues in the health part. And actually, when we had that conversation, I made sure we started to try and feed back into those things. So we were doing the right things, but actually our communication could have been improved if we were working through with other people. So that's something that is something that quite happens when you're under pressure. But actually, if I'd had that hindsight again, I'd be going, okay, we can help. That could be helped by working with others to deal with those pressures and issues.
Quite right. I would say that what we discovered during the pandemic is, in a sense, some existing partnerships, but we also had some latent collaborations that came to the fore when the need was really there. And as you say, I think initially we all tried to deal with things in-house and as much as we could within our own fields, but we quickly discovered that actually doing so with others was going to be more beneficial, and it has been a snowballing effect in that sense. Home but Not Alone has been a great success, and that was a good example of how things could happen really quickly, and organisations could come together really quickly with one aim in mind. Could you just? I know you covered the BAME, Black, Asian, minority ethnic issues really well. And by the way, that was a community person that mentioned that in the event, the What Are We Missing event. Could you just talk about public health's work with the wider system, say, I don't know, care homes, but also primary care and secondary care? Just touch on those.
So a lot of the work we're doing at the moment is now being driven through the local outbreak control plan, and the idea of the plan, and I was really clear from the beginning, is that going back to my previous learning point, we can't do that on our own. Public health could sit there and try and write a plan, and a plan's only as good as the people you're involving, and actually the plan normally falls to pieces relatively quickly. It's the relationships that you build is what gets you through these things. So we'd already started to build those relationships, but the plan has helped us to kind of codify and bring people together to start responding to coronavirus at a local level. And I think that's one of the things actually that's been positive that's happened actually, and a reflection on what we probably needed to have done earlier, was that the recognition that actually local level is the place to respond to this. And very much I think the standing for public health locally is improved, or the understanding at a national level has improved quite a lot. And I think related to that, we work very closely with our partners at regional and national level, and obviously we'll have to see what happens with the National Institute that's being set up to deal with health protection. I mean, I think the key thing is there's lots of dedicated people in there, and we will still work with really closely. We'll just have to work and support with each other as we go through that change. But with regards to things like care homes and that, we have a cell set up. So a lot of the terminology around COVID is around emergency planning. So we talk about cells, which is a strange word, but bringing together people from care providers, bringing together health colleagues, public health, through our adult social care, people coming together to look at the issues and the problems and to then try and come up with solutions in a collective way. So a really good example of how we do that, and really important to have people from the providers there, because we can't pretend to have all the knowledge. And I think it feeds very much into that kind of that asset-based bottom-up approach, that actually we need people working on the coalface to be feeding into that in the same way that you need people from the communities to be giving their understanding of what their challenges and issues are around COVID. So very much through the local outbreak control plan, we have a number of different work streams that bring together different partners for different focuses, whether that's workplace, education, care, and then also looking at things like enforcement and also public spaces. So within that, we've got representatives from district and boroughs, from places like local economic partnership, from health, and other work streams where voluntary sector are feeding in, and that's the way that we're trying to do our response now. So it's not public health on its own; it's a system response to COVID.
Good. All right. Thank you. Thanks for building that picture up. We're on to the last question now. It's about the future, looking to the future. So what learning, I know you've covered some things already about learning, but what other learning do you think will come from this outbreak?
I think the thing that stands out is actually how our communities responded. I mean, a lot of this discussion is about me as Director of Public Health and what public health's doing, but actually watching how communities came together and groups popped up very quickly to meet needs, to support their fellow local residents, was an incredible thing to see. And I think there is a question there around. I think we've become a bit negative about society, about how things work sometimes, but actually it really showed how people were willing to stand up and work together. And I think we need to continue to learn from that, the power of individuals in their communities, and about how them coming up with their own solutions to challenges and issues, which isn't public sector coming there saying you have to do X, Y, and Z. So I think we need to not lose sight of that. I think for me, there's also the question about, and it comes back to, I suppose, I work in public health, so for me everything is connected. But I think now more than ever is really driven home the learning that we can't deal with any of these issues in individual silos. So if we're looking at actually electives, so looking at hospital elective activity at the moment, getting people back into care, how do you prioritize that? How do you look at, and how does that relate to your issues around health inequalities and needs? And so in all these things, we're all thinking about how these things are interconnected with each other now. And for me, again, the economic impact, that if people aren't earning money, then it's quite difficult for them to self-isolate. So we're just seeing all the connections between this. And I think as a system, and when we look at our recovery planning, how we're going to work out how we're going to build our way out of the current situation, I think there's now a better understanding that we need to be working together and doing the neural network, or the wiring across all these things, because actually on their own, we're not going to do it, but actually everything is connected. It makes it a bit scary, but I think actually if we're going to have an impact, we need to recognize that and see what's happening in our economic growth team. How's that going to impact on health and well-being? And then I think the final thing for me actually has been around the flexibility and the fast-paced working. I've seen some of my team really flourish doing completely different things that they've ever done before. And actually, it's been great to see the energy and the enjoyment. Some people have been doing those jobs for quite a long while and actually suddenly been thrown into a different arena. Now, some people I think have struggled with that more, but I think there's a question about, I suppose, diversity of thinking, and actually bringing in different people to different problems to solve those problems and to come up with solutions, but to do it at more of a fast pace. I know public health gets criticised for spending a lot of time for writing very long reports, but I think when it comes down to then looking at the solutions, very much we've seen this collaborative working, people coming together, and very much I'm still want to try and to use that as an approach for trying to do more work across the system. So a collective approach, getting different people with different views and different thoughts to then inform, because that's a far stronger approach than somebody sitting in a darkened room writing a report and coming up with a solution. And hopefully that will change. I want to look at with my team about how we change the way that we do those things.
Very good. The last point that you've talked about the diversity of or diversification of what a team can provide makes me think of icebreakers at meetings, where you ask the person to both describe their job but then also themselves, because it's the kind of thing that you don't really get to know about somebody, but you discover that in an emergency or in a situation like this. The other thing I just wanted to take up a little bit more of your time on is, so looking ahead, there's a suggestion that we're going to be living with COVID or some aspect of COVID for a long, long time into the future. So whatever we've learned to do differently, I guess we need to take a hold of and try and keep all the good stuff in the way that we do things in the future.
Yes, I mean, firstly, I think COVID is going to be around for a while. I mean, what will likely happen is that we will hopefully develop some vaccines which will help. We'll have some treatments that will mitigate if people do get COVID. But the likelihood, I think we're hearing from the WHO and people like that, is it will be here in some form or other. And that's not that unusual. If you look from history, things like bubonic plague is actually still around now. It's just the fact I think we developed antibiotics, but that could treat them. So that's kind of the first thing. So we are having to adjust to the way we live and work. And actually from that, there's some benefits from this, and there's obviously clear negatives as well. So I think I think yes, we need to look at and take advantage of those opportunities. And I think if you talk to colleagues and some of the faster paced moving and actually really bringing people together to solve problems is one of those strengths. But it's also looking at more fundamentally about, I think for me, from a public health perspective, around climate change and the travel part of things. Actually getting people around active travel, the opportunities that we're getting more cycle lanes being put in, and how do we support that? But also looking more fundamentally, what does this mean for society in the longer term about communities, high streets, how we interact with people? So I think as part of what we call our recovery planning, we need to look at both those opportunities, but then look at how we can overcome some of the challenges and issues that we're seeing. We clearly need to get on top of the virus, and we need to do it in a way that enables us to live our lives. I do believe thoroughly that the economic impacts are going to have a significant adverse impact in the future. So we need to keep people safe now, but we need to do it in a balancing act, and that's what we're trying to manage, a balancing act between a complete lockdown and a complete where the virus roams free, and we can't afford that. The impact on people's lives is far too much of a cost for that. So that's what we've got to do. We've got to adjust to the way we live and support people in that, but also take the advantage of those things that actually might be beneficial and people might enjoy more in their lives, more generally.
Thank you. Stuart, thank you very much for all your thoughts.
Okay, thank you.